Welcome to The Explainer. I am so thrilled you're here with us today. Look, we are diving straight into what honestly feels like the wild west of modern health right now. Regenerative therapy. We're talking stem cells, exosomes, the whole shebang. There is just a ton of information and, let's be real, a lot of misinformation out there. But we're going to break it all down clearly and logically. Our goal today is super simple. We want to equip you with the exact knowledge you need to confidently vet providers and set truly realistic expectations for your healing journey.
Okay, let's dive right into this. The absolute foundation of our explainer today is this one core truth. Even if the product is great, it still totally matters who is actually using it. Seriously, you could have access to the absolute most cutting-edge, top-tier regenerative product in the world, but in the wrong hands, it's practically useless. The skill, the knowledge, and the integrity of the provider applying that treatment are just as important as the biology itself. The stakes are incredibly high when we're talking about your body, which makes vetting your clinic an absolutely crucial first step.
Which brings us to the core conflict you face as a patient, right? How do you actually separate the true medical experts from the slick marketers? Because regenerative medicine holds this massive amount of promise, it's unfortunately attracted a lot of completely unregulated clinics just looking to capitalize on the hype. You know the type. They have these glossy brochures and make huge promises, but they completely lack clinical depth. So how do you cut through all that noise and find a provider who is actually going to evaluate your treatment plan with real medical rigor? Well, to solve that, we've distilled the source material down to a specific before and after blueprint to help you investigate.
So let's start with Section 1, vetting your provider with our 7 crucial questions.
Now, what's really interesting here is that out of all the questions you could possibly ask, this is the single most important regulatory check you can perform. You have to ask, is the facility FDA registered for HCT/Ps? For context, that stands for human cells, tissues, and cellular and tissue-based products. If a clinic is handling regenerative materials like stem cells or exosomes, this registration is a strict baseline requirement. If they can't answer this simple regulatory question with a confident, immediate yes, you should absolutely reconsider moving forward with them.
Once you've established regulatory compliance, you need to dig right into the clinical details. Here are 4 more essential questions you've got to ask. First, what product are they using and exactly where is it sourced from? You have to know what's going into your body. Second, what kind of follow-up or recovery plan do they actually provide? This is key because a truly great doctor evaluates a treatment plan by looking at the entire recovery arc, not just the quick injection. Third, what outcomes do they track? This is huge. If a clinic isn't tracking data and patient outcomes, they just aren't practicing rigorous medicine. And finally, what specific training or certification does their staff have in regenerative medicine? Believe me, a knowledgeable provider will actually welcome this level of scrutiny. They want educated, curious patients.
Moving on to Section 2, the treatment protocol and how the therapy is applied.
Okay, we aren't quite done vetting yet. We need to look closely at the medical process itself. The final 2 questions on our checklist are all about the how and the why. First, the provider must clearly determine and explain the administration route for the product. Are they doing an IV, a localized joint injection? And second, and this is a big one, they must explain exactly why that specific route was chosen for your particular condition. This gives you a critical window into how doctors evaluate treatment plans in real time. They shouldn't just be guessing or throwing things at the wall. They need to justify the biological pathway they are utilizing to get you the very best result.
And really, this highlights the stark difference between a marketer and a true medical expert. A marketer leans on a one-size-fits-all approach. This is the clinic that gives every single person who walks through the door the exact same standard IV drip no matter what their issue is. But a real medical professional, they build patient-specific protocols. Your treatment absolutely shouldn't be identical to everyone else's, because your biology and your injuries are completely uniquely yours. A proper medical evaluation always results in a customized protocol.
I want to be incredibly clear here, speaking directly to you as a consumer and a patient. You hold the power in this dynamic. If you ask these 7 questions and the provider hesitates, if they kind of dodge the specifics, or if they brush off your concerns like you're bothering them, that is a massive red flag. Do not ignore it. You have every right to literally just walk away, protect your health, and protect your investment.
To wrap up the before stage of our blueprint, I really want you to burn this quote into your memory. Regenerative therapy is not just about the product. It's about the protocol, the provider, and the process. It's a complete ecosystem of care. Properly vetting your provider ensures that all 3 of these Ps are operating at the absolute highest possible medical standard.
All right, Section 3, managing your expectations.
what stem cells and exosomes can and definitely cannot do.
Okay, so you've asked the right questions, you found a fantastic provider, and you are ready to begin. Let's shift gears from the investigative phase into a really grounded, realistic look at the biology. First things first, let's completely debunk the fountain of youth myth. Regenerative therapy does not magically reverse time, and it is absolutely not a permanent cure for chronic disease. If a clinic promises you that, please refer back to our red flag rule. So the crucial point is really focusing on what it actually does. These therapies create a better environment within your body. They regulate inflammation, they send signals to your existing cells to promote healing, and they support structural balance. It's all about environmental body signaling, not magic.
Because we are dealing with complex biological signaling, you really have to understand the timeline of healing. Let's walk through this together. On day 1, the treatment is entirely focused on internal signaling. Honestly, most patients don't feel any immediate effect at all. Biology just moves slowly. Days later, your body begins to slowly regulate internal inflammation in response to those initial signals. It isn't until weeks later that you might actually start to see visible or tangible improvements in things like joint mobility, clearing of brain fog, or getting better skin quality. And remember, results vary widely by individual. Patience is absolutely essential here. Your body just takes time to do the work.
Which brings us to Section 4, the bigger healing picture and our supportive strategies.
And this brilliantly illustrates how top doctors actually evaluate long-term treatment plans. You have to look at the whole picture. As you're waiting for those biological signals to do their work, you can't just sit on the couch and wait. Regenerative medicine is not a standalone, magic bullet cure. You really have to think of your injection as just one piece of this overall health pie. To maximize your investment, regenerative therapy has to be paired with supportive strategies. You need dialed-in nutrition to provide the actual building blocks for repair. You need hormonal balance so your body is in an optimal state for healing. You might need physical therapy to mechanically support the biological changes happening inside. And of course, overall lifestyle optimization, like prioritizing high-quality sleep and reducing stress, is totally key.
Ultimately, the success of these treatments doesn't just rely on the doctor or the specific product. It relies heavily on you. To get the absolute best possible results from regenerative medicine, patients have to be 3 things: educated on the process, which, hey, you're doing right now, committed to the broader supportive strategies we just went over, and incredibly realistic about the timeline and the actual biological realities of healing. It's a true partnership between you and your body.
We've covered how to vet the experts, how to understand the slow biological timeline, and how to support your healing along the way. But this leads us to a fascinating next step. Whether you are seeking peak joint health so you can finally get back to running, trying to clear out that stubborn cognitive brain fog, or even looking at aesthetic improvements, how exactly can these therapies be tailored to fit those highly specific, individual goals? That is a complex and really exciting puzzle, and definitely something to keep in mind as you continue your research. Thank you so much for joining me on this explainer, and remember, stay curious.